Hey, Kelly. It's such
Hey,
a pleasure to see you in virtually side because we know each other in the person, and it's kind of different to talk to you in this way. But I really want to say to you, thank you for accepting my invitation. You are my first international guest in my project, in my podcast.
oh my goodness, but thank you so much. This is such a great opportunity for me too.
Yeah,
Not only as a person, but it's a great opportunity for for my company as well. So this is great. And thank you for
yeah.
your patience for waiting for me. So long.
No, it was pleasure for me and kind of excited. And thank you also for supporting and helping me in my project, as I will continue to support and help you in your project that you just started your business for telemedicine. It was so impressive for us as your friend and for you also as a
Yes.
professional, as a woman, as a mom, as a friend, everything.
Yes.
How is
Yes.
going with a new
It's going
project?
very well, but like you said, it's definitely it's a very exciting project. It's been in the back of my mind for so long.
Mm,
And it's something is like mine, right? Because I always worked for big organizations, for hospitals, and anyways, now I feel like it's something it's my own. I can do it my way. And I'm very happy because I feel like I'm bringing like affordable and accessible healthcare for for people here in California, but we also license in Florida,
mhm.
and now we're planning to expand to New York and Massachusetts as well.
Yeah,
So yeah, so it's been like very excited. It's for sure is a such like a learning um process. I learn something new every day, and
mhm.
it's a lot of adjustments we have to do every day. When I feel like something is going the right direction, I have to pull back and start over again.
Yeah.
But overall, it's great. It's very nice.
Yeah, it's so
Very happy.
excited to hear that,
Yeah.
Kelly, and I'm so
Mhm.
proud of you, girl.
Thank
Keep
you.
going. And Kelly, can you tell me, can you describe me that moment? Because you just say that you kept in your mind for a long time this project you planned before.
Yeah.
And where was the moment where you told yourself, hey, Kelly, this is the right moment and keep going. Let's do it.
Yeah, yeah. So you know what? I feel like a lot of times we are like in general, like everybody has like who like to do something, but we never know is this is the right moment?
Yeah.
Is this is the right time? Am I able to do this now? And I've been like debating, going back and forth, at least for the last, I would say probably 10 years of my career. And I see things being done, and I always question myself: Can we do this better? How we can make this, uh, you know, affordable for everyone? Because healthcare it is expensive in
Yeah.
this country, right? And unfortunately, not everybody have access to a healthcare or a good quality healthcare. And then I said to myself, okay, I think now it's time. It's
Mhm.
time. It's time for me to start something. Like every single business, you take time
Yeah.
to build up. So I said, if I don't start now, it might be a little bit too late. I might not have the
Yeah.
energy anymore because
Yeah.
I'm
Yeah.
getting old. So and I always have like in my mind that I'm an immigrant.
Yeah.
This country gave so much back to me, gave me my education, gave me like job opportunities. I met some great people on my way up that
Mhm.
helped me, and I feel like it was time for me to give back, right?
Yeah.
Give back to my community, but not only my community when I say like my Brazilian community, but the community in general. All these people who was part of my journey is people that helped me to get where I am right now. I think is my call moment is it's time for you to give back. It's time
Yeah.
for you to give back to the community somehow. So I thought telehealth would be great approach because I can only reach people around me or people from the city where I live, but also can, I can go across state as well. So But so I'm very happy. I think that was the moment for me. I need to do something. I need to give back.
And I'm pretty sure that you're gonna do the best thing in your way, because according to your previous career and your career actually that you are doing as a nurse practitioner, you're going to do your best, and this kind of field, it's related to each other, but maybe with a little bit differences. Can you explain the differences between telemedicine and your job that you're actually doing, or you did for a long time?
For you to become a nurse practitioner, you have to be a nurse first, right? So we do have a nurse practitioner license, but before that, those nurse practitioner license is attached to a nursing license. So we can be a nurse practitioner without being a nurse, right? So as a nurse practitioner, I usually work in acute care setting, and I work in hospitals. Like for the most part, in my career, I work as internal medicine provider. And so you always there, you always at the bedside, you always hands-on, right? On the patient or the skills you have to perform. Now, when you switch gears completely to telemedicine, now you are trying to do the same skills or function the same way through a video chat, which is completely different. I don't even think you able to
compare.
Yeah, 100%, because the important thing in telemedicine, you have to have a clear understanding of your limitations. Yeah. Because you do have limitations. It's not everything you can treat it through telemedicine, right? So I do have patients in primary care who needs a pap smear. It's a skill. It's something have to be performed in person. So I do need to know my limitations when I am a nurse practitioner inside the hospital compared where I am, perform this, my profession through telemed.
And what was the challenges, the biggest challenges in this journey?
Yeah. So the bigger challenge is I feel like I do have a clear understanding of my limitations, but it's the general population, the patients they are not in this field, they are not in healthcare field. Some of them, they don't have a clear understanding what I can do, what I can't. So is this being like a challenge in a process, because a lot of people looking for me, approach me, call, they got to the point to go to my website and make appointment. And then when we got to the appointment, they might need something that I cannot manage via telemed. So so that's where the bump and the barrier is. I do have a clear understanding, but I don't feel like the patient doesn't have a clear understanding what I cannot do. But like I said, I feel like even though this is a challenge, I feel like it's a great opportunity for me to teach to the population, what telemedicine is. Yes, I'm here. I'm able to do a consultation via telehealth. I'm able to order laboratory studies for you. I'm able to order your mammogram. I'm not going to be able to do your pap smear, right? Yeah. I'm not with you. I'm not going to be able to do a breast examination because I'm not with you. I'm not going to be able to do your full physical assessment, which I have to touch. I have to listen to your lungs. I have to listen to your heart. I have to listen to your abdominal area. So that's are the limitations. So I believe telemedicine is more focused for a specific service, such as hormone replacement, or for the male population, testosterone replacement, or medical weight loss, and maybe some basic urgent care, right? Like common cold, common skin infection, ear pain, urinary tract infection symptoms, but nothing that it's needed for me to be in person to do a physical examination. And this is the big barrier. And I think as a provider, we have to have a very clear understanding of our limitations for the safety of the population and also for liability. Yeah, it's like I said, it's a lot of teaching. I've been feeling like I have a lot of teaching to do to my patients.
Do you feel that your clients, your patients, just accept it in the best way, all the services, all the way that you explained this? How can I say? It's something new in medicine field.
A lot of my service it's can be safely performed via telemeds. With exception of primary care. Like I said, primary care, if you're looking for an annual checkup, usually this involves a physical examination. It's something I'm not going to be able to perform. But I feel like when I explain to them the way I explain to you, it's for the best care, quality of care is the best for you to see a providing person so you can have your physical examination. I can do part of your annual checkup, such as laboratory work, prescribed to whatever test that is needed for you to check annually. But when it comes to something you have to be performed in person, I think as long as I explain to them, it's for their own good, for their safety. They are very understandable. They receive the conversation, the educational piece very, very well. When it comes to the other service, I don't really need to be with the patient so it can be safely performed because the other service is pretty much based on laboratory studies. It's something that can be ordered, can be interpreted via telemed, so it's no problem. So they can be safely performed. So I think the patients overall have been receiving that very, very well. And they're actually very happy because it's very convenient. You can just be at home and you having cold symptoms and you don't have to go to urgent care and wait for an hour or two, or even go to the ER and wait for 5-6 hours.
Yeah, it's terrible.
Yeah. So you can just send me go to my website, fill out very quickly information, put it there as urgent care, and I can get you in like in 30 minutes to 1 hour. Actually, I have a patient that contacted me and say, do I need to go to see you somewhere? I'm like, no. It's a telemedicine. Oh, this is great. It's virtually. I like that. So I think it's everybody's life. It's so busy, right?
Yeah.
With the work schedule, family, kids. So I think I think telemedicine came to, and they will stay. It's sure it's booming with the COVID pandemic, but I don't feel like it's going nowhere. As long as the provider knows their limitations and practice medicine the safety way, I think it's great.
Are you giving a service for all type of gender, ages?
Yeah, that's a great question, Vete, because I'm licensed to treat 13 years older or older. So I don't see a population below 13 years old because that's not my license. That's not something I specialize.
Okay.
So I pretty much don't see pediatrics. I see adolescents until end of life, which is any age after that.
Good. And maybe it's early to make this question because you just started, but maybe you can be able to recognize the idea what kind of services people are interested to do the telemedicine that you're offering, in what they are more interesting to do that.
I think it's the short period of time I'm been running the telemedicine clinic. I see a lot of ladies very worried about with what's going on in their body and mentally as well with like all the hormone change after 40 years old, right?
Yeah.
So I have a lot of most of my patients if it's and their with their age group with that concern. But I also have a lot of patients come to us to do the medical weight loss, which is big across the world. Everybody talking about this magnific break news medications, which is the Ozempic and the Mounjaro, which is not used as a Mounjaro anymore. They're called Zepbound now. But and we have quite a few male patients as well with the same concern, looking for testosterone replacement after the age of 40 years old. They don't want to feel tired anymore. They feel like they lose muscles. So most is in that age group, and the service is pretty much between hormone replacement for male and female and weight loss as well. And I think the telemeds setup is very good for those areas because, like I said to you, it's something that you can safely manage. It's something that you can safely practice meds via telehealth, right? Some areas in meds is not best set up for telemeds. If something you have to be all the time touching the patient, it's just not. Like, again, we're going back to limitation. Yes, we do have limitations. We can do a lot. I feel like we can do even, I have a patient who comes to me and say, I have this problem, and I don't have no problem to say, you need to go see your primary care doctor. You need to go, to have somebody to look at it, like in person, right? It's might not be just a wound. A wound can be seen very different. The colors can be very different when you look in the video chat compared when you look in person. People who have understanding, like I do have understanding, and the way the wound look like, the color, the drainage, a lot of things, they tell us a lot to us. So maybe telehealth is not the best way to take care of the wound. You have to see somebody in person.
Kelli, can you tell me which is going to be your best advice for the woman in their 40s on how to manage hormonal problems and stress also?
So this is a very great question. And this question has been going on for years because there's a big taboo when it comes to hormone replacement. Every country, I noticed, they deal in a different way and they approach in a different way. And the reason it's a big taboo because a lot of studies out there, they are pro hormone replacement, and a lot of studies saying that no, you should not, because we have this several risks, right? So the way I see is, it's not reason for us to go through without help. I have a lot of patients, 42 years old, 43 years old, they already go what they call perimenopause, which is you start feeling the symptoms in a very early age. We're talking about feeling tired, more like tired and more than normal. I'm feeling tired, but I'm not doing nothing different. I'm still have the same routine. Why I feel like so tired, right? And why I feel like it's the menopause or perimenopause or premenopause, they're all different phases. They come with a little touch of depression. Some people start feeling like, they don't feel the desire to do things that they used to do before, right? And it's all the symptoms. Why I feel like my weight is concentrated around my abdominal area, because that's where it happens when you have hormone imbalance. You start becoming what we call visceral fat, is around your organ, around your belly area, right? So all this thing happen when you advance the 40 years old, and then you start seeing hot flashes. You start seeing people cannot sleep well anymore. You feel insomnia. And then you have the mood swings for no reason. Sometimes you're so happy, but another times you're so sad. You become so like irritability, a lot of irritability, like why I'm so angry for no reason, with my husband, with my kids, with friends, right? And then we see the low libido. I don't have desire anymore to have a sexual life with my partner.
Yeah.
So we all been for years, decades, suffered through all this up and downs. But unfortunately, we have a lot of barriers, right? With this, a lot of providers does not. It's not like they don't believe those changes are happening. They do believe, but a lot of providers is stuck with the risks.
Yeah.
My patient's suffering, but should I put her in hormone replacement and take the risk of maybe later on she develop maybe I don't know, a blood clot or cardiovascular issues. But then you have studies saying that if you don't address those symptoms, if you don't address the hormone imbalance, you actually develop cardiovascular problems.
Mm-hmm.
Because when you don't regulate your testosterone or you regulate your estrogen, you have the risk to develop high cholesterol. And high cholesterol can develop problems with the cardiovascular issues.
Mm-hmm.
Right? If you don't regulate the testosterone, that can affect the way your heart rate, they affect the way your heart function actually.
Mm-hmm.
So we are in the middle of this study saying that yes, if you do it, you might develop blood clots, you might develop breast cancer, but if you don't do it, you also can develop vascular issues, cardiac issues, and they even have studies saying if you don't address, you can even develop problems like Alzheimer's and dementia.
Mm-hmm.
So we're in the middle of the road, right? So it really goes, every provider takes a different approach, and every provider takes the step to assess the patient and check the hormone levels when it comes to laboratory work, and that actually prescribe something, while others just don't want to do it. I don't want to deal, I don't want even to, take the risk, or the patient take the risks, right? But then you have two different treatments. You have the synthetic medications, which is the one actually shows that they have a high risk to develop the cardiovascular issues and the breast cancer, right? But then now, thankfully, we have what they call the bioidentical hormones, which is identical of the hormones you produce in your body, which have none to minimal risk to develop any issues. So if you do cautiously with the right approach and the right way, it's not the population, it's not at any risk, right? So, and then you can regain like what the way we used to be before. No more mood swings, not feel like anger all the time, no more low libido. No, we can have 8 hours of sleep, what you used to have before the 40s, 45 years old. So why not, right? If we're doing the right way, why not? But I see that unfortunately a lot of us been suffering for years and decades because a lot of providers doesn't take the approach of to try to offer or to even listen to those symptoms. And on top of that, unfortunately, insurance usually does not cover some of the labs.
Yeah.
So a lot of those women have to choose to pay privately out of pocket, and can be expensive, right?
Mm.
Those laboratories exams can be expensive. And those bioidentical medications can be costly sometimes, a monthly supply.
Does telemedicine service is expensive, or it's more convenient for the patient right now?
It's more convenient for the patient because if you're thinking about it, a provider who offer a telemedicine treatment, we have less expenses, right? Compared to somebody who actually have a clinic in the corner. Because if you have a clinic in the corner, you pay rent or you buy your space, which is still costly as well.
Yeah.
And you have staff, right? You have to have somebody to run the front office, a receptionist, you have somebody to run the back office. So you have to pay for everything, like electricity, water, etc., etc. And when you have a business, which is a telemedicine, you can cut out these costs. You pretty much have your computer or your laptop, and your space is your office or it's a space inside your house. Yes, you're still paying the electricity, water, and this and that, but it's something you already had before because it's your house, you're using your space, right? So it's a lot of overhead cut when it comes to cost. And so you can pass that to the patient. Mm-hmm. Because I don't need to ask so much for my service because I don't have so much expenses as well. So that's the difference, right? And that's what you got to say. probably an in-person consultation, you can be, I don't know, usually $240 if you don't have insurance. You pay out of pocket. Compare that if you do a telehealth, can be anything like $70 or $80 or $90. So it's a big difference for sure.
What role of technology play in the success of your telemedicine platform, and how can you stay updated with the latest advancements?
So technology is it's a number one thing in telemeds, right? The ability that you can be anywhere and see your patient, talk with your patient, and give advice to your patient. It can be in a phone, it can be in an iPad, it can be in a laptop. So it's great. At the same time, sometimes it can be a little bit problems as well when things are not working very well on my way or on the patient with the patient way as well. And how I keep like update on that, it's pretty easily, yes, actually, because in telehealth and telemeds, we all use what they call electronic medical records. It's a platform that we all use. We have many companies out there you can work with. And you can pretty much choose one, partner with one, and they provide a whole platform, whole electronic platform. And it's pretty amazing because they develop a system that is HIPAA compliance, which is a federal law where you have to have confidentiality while you talk with your patient. So everything is already in the system. So it's easy, convenient, as long as you work with them. It's sure you have to subscribe. It's have like a monthly cost for their providers and telemeds. But they pretty much stay up to date to everything. So we don't have much to worry about or much to do. When they have to do changes, they just tell it, hey, we're going to do changes for have this better video chat. But we have everything there. Like patients can text me electronically and be everything confidential. Patient can send me facts, go straight to the medical records and stay confidentially between the patient and I. So it's not much for me to worry about providing as an owner because I just have this great platform and they stay in compliance with federal laws for me. And it's pretty much like I just have to click the right button and I can start treating people.
What do you see in the future of telemedicine, and how is your services preparing to meet future healthcare demands?
Like I said, I don't think telemedicine is going nowhere. I don't believe they will substitute like in-person care for certain service, like I said. But I feel like you have, we have people in a very rural area in the United States that it's hard for them just to get to the nearest hospital, just to get to a provider. So I feel like I'm getting ready. I'm getting prepared. And also another very good thing is we're getting older, right? With the baby boomers that's out. And those people have a hard time mobility-wise to get out of the house as well. And they need to be treated as well. So I think I'm getting prepared by, like I said, keep up to date what's out there, right? What's new, what else I can integrate to my service. And that's something it's moving, it's happening every day. And like this AI, it's just like amazing how, things can be done.
Yeah.
Right? It's pretty much, I don't have to be, I don't know, I don't have to take the time anymore to check on my patient. I can just click like create a message, check on my patient, how he's doing the new medication. They just send the message. So I'm, it's every day learning something different and keep up to date with this technology. But like I said to you, I think the platforms they've been out there for telemeds is also trying to keep up to date and up to speed with everything going on. And they help us as a provider to stay in line with what's going on, which is a good thing because if I have somebody worry about to stay updated technology, I feel like give me a free time to actually do what I do best, which is treat people. So right? We have somebody else worry about to keep up to date with that. So I think I'm going the right track. I think I partner with the right people. When they have something new, the team always alert me, hey, we have this new thing now. It would be easier for you to text the patient. It will be easier for you to get in contact with another provider, because a lot of my patients have to refer them to like a different specialty. Why we have this one way you can speak with your patient neurology. So I think I have somebody in the back,
Yeah.
like somehow a virtual back office people keep me going, what's going on out there.
Luckily that you have a good team behind of you and to support and to go further. And
Yeah.
Kelli, in this case, can you share with me any success story of your patient, how telemedicine has significantly impacted patients' care?
Yeah. So I'm going to give an example of a patient who is, it's a very sad story. It's a young man who been, unfortunately suffer of chronic obesity for many, many years. And he's had health care. He has his insurance. He works from home. And because his weight, he have very limited life, which means he pretty much lives inside his house because his weight prevents him to gardening, just go out of his door and, enjoy his garden, or, put water on his plants. Forget it, got to a car and drive to a supermarket, right? Because it's just too hard for him. His legs is big, hurts. It's just hard, very hard. It's really even hard for him to go see his doctor, his primary care doctor, right? So, and he's been better for the past year to 2 years to get approved to his insurance to approve those medications for him to lose weight, which is very disappointing, because if you look at his history, he has all the indications that if he decrease his weight, he's going to gain his life back. He's going to have a quality of life. He's going to be able to do simple things like you and I do. I feel when I don't have milk, I just jump in my car and I go to the closest supermarket and I buy a gallon of milk. He doesn't have that privilege. It's such a small privilege, right?
But for him, means a lot.
Yes, yeah. He doesn't have the energy or to just open his door and enjoy the rose he has in his garden, because if he stays stand for too long, this hurts too much. Even inside his house, he needs to walk with a walker, with a cane.
Yeah.
So he has this whole team, because this man developed everything. He has sleep apnea. He has depression. He has anxiety. So he has a lot of health issues, elevated blood pressure. He has a lot of health issues there. He developed wounds in his legs because it's big, and he has a lot of edema. He has stretched his leg, and now he has open wounds. So he has a lot of healthcare providers treating him, because he needs a neurologist, he needs a psychiatrist, and everybody has been trying to approve this patient to receive those medications, to receive Ozempic, to receive the Zepbound, also known as a Mounjaro, and the insurance keeping denying. For somebody who you can see in their BMI, he needs the medication. You can see through his healthcare issues, if he drop weight, his sleep apnea will improve. If he drop weight, the wound will be easier to treat. If he drop weight, his blood pressure is going to be well controlled. If he drop weight, his depression will be well managed, because he regain his self-esteem. So he will not be so depressed anymore. It's so many factors he'll be benefit for him to control his weight, but no, every single door is being closed for this man, right? So through my company, I was able to reach out to him. He was referred to me by a provider. And yes, the medication can be a little bit expensive for somebody who have to pay out of pocket. But I'm so happy and that I'm helping this man, I told him, yes, the expense can be a little bit expensive, the medication, but hey, let's work together, right? let's work together. Yes, I'm a business. Yes, but let's work together because I want to help you. I want you to be able to go out and enjoy the flowers in your garden, right? So now for 2 months, he's been treated for 2 months. He already lost 16 pounds.
Oh.
The wound care doctor said the wound is a little bit more manageable now. And he said he actually able to walk inside his house without his cane or his walker. It's
Nice.
still hard a little bit to go long distance walking, but he feel like he's more mobile inside his house. No, he doesn't need those devices anymore to walk inside his house. And I'm so happy for him. And such great to work with him and treat him because he's very compliant. He makes sure he watch what he's eating. He have his water intake. He takes his protein. So he's more from the first consultation for 2 months later, you see he has more joy in the way he talks.
Yeah.
As
For
he-
2 months, you achieved this
2 months.
result?
Yes.
Yeah, it's so impressive.
He's happier. You can see the way when he talks to me. He's more, I see like mentally he's happy. He's happy with himself. He's proud of himself where he got, 16 pounds after 2 months. So it's just great. I received a call from his wound care doctor, said, Kelli, you know what? If you can see his leg, it's much smaller now. It's going to be easier for me to control his wounds, to treat his wounds. So it's just, for me, that is my big payment. Really.
Yeah, absolutely. When you see the success to your patients, to your job, to your investment, it's the
Yes.
great thing ever. No money to pay this feeling. I absolutely can feel it. You do a consultation with him every single day, or?
And so in the medical weight loss, we follow up with everybody once a month.
Once a month, yeah.
Yeah, because we want to make sure they're on the right track when it comes to nutritional and exercise. We overview like how the diet look like, what you've been eating. Are you putting some cardio exercise? Are you lifting a little bit weight? Like we need some lightweight because we want the patient to lose the fat, but we don't want the patient to lose the muscle because the muscles are very important. We review how much protein they are taking daily, and sure, we review their weight. Right?
Yeah.
We recommend all of them we have a special scale, which they give you like your whole body composition, and they are responsible to weight yourself once a month, take a screenshot of the body composition, download in our platform we go back to technology. We have a platform that they link the scale to the platform. So I can receive all the numbers, the body composition monthly on my electronic medical records for every single patient, because we want to make sure they are losing weight, they are losing fat. But I said to you, that special scale tell us if the patient is losing their muscle as well. We don't want to see that. So we follow up with them once a month, right?
Oh,
because
okay.
we need to see if the medication is working. We need to make sure they don't have side effects, such as nausea, vomiting, or abdominal pain, or constipation, right? So we follow up with them. We do like a weekly checkup with them, but the weekly checkup is due via email or via text. But we do a video chat once a month with every single patient, with a hormone replacement patient or the weight loss patients.
Yeah, I'm gonna make this question again just for me because I didn't do it the correct way. How often did you follow up with your patients? Is this the right question?
That's the right question.
How often did you follow up with your patient? Yeah. Okay. Kelli, it's such a pleasure for me to hear all those stuffs from you and for your business, for your dream project. And I wish you all the best, and I wish you good luck and success in your journey. And I'm so happy for you. And thank you for your time.
Thank you. Thank you, Yvette. Thank you so, so much. I'm so excited. It was the first podcast I did ever. And I'm so excited it was with you.
Oh my
Because I
goodness.
got to know you a little bit, and I really, really, in the back corner, I've been rooting for you. Like you do awesome. I never said verbally, but each time I see you in a video or heard from you through our common friends, I'm like, well, I hope she does well. I hope she's okay. I hope she's,
Yeah.
so I just want to make sure that I never
Yeah.
said verbally, but in a corner, I always send you a good vibes and a positive vibes for you.
Mm.
So I'm very happy for you as well.
Yeah, thank you, Kelly. I'm always gonna remember my first time when I meet you and your advice and you supporting for me in the beginning here in USA as an immigrant. Hey, Betty, we are in the same boat. I'm immigrant too.
Yes,
Even though you came here
absolutely.
a long time ago. And yeah, I
Mhm.
remember that. I think it's very important for me. And I'm so lucky with all the people around me, you and my Albanian girls and my
Yes,
international friends now. Yeah, thank you
yes.
so much,
Thank
Kelly,
you.
for your
Thanks for
time.
having me. Thank you so much.
Yeah, see
Thank you.
you. Good
See you.
luck.